Occupational English test. Listening test. This test has 3 parts. In each part, you'll hear a number of different extracts. At the start of each extract, you'll hear this sound. You'll have time to read the questions before you hear each extract, and you'll hear each extract once only. Complete your answers as you listen. At the end of the test, you'll have 2 minutes to check your answers. Part A. In this part of the test, you'll hear 2 different extracts. In each extract, a health professional is talking to a patient. For questions 1 to 24, complete the notes with information that you hear. Now, look at the notes for Extract 1. Extract 1, questions 1 to 12. For questions 1 to 12, complete the notes with a word or short phrase that you hear. You now have 30 seconds to look at the notes.
Hello, doctor. Good morning.
Good morning. May I find out what the problem is?
I've been experiencing the symptoms of heart failure for the past year, doctor. Although it appears okay in general, I feel a lot of stress and fatigue. I've also noticed shortness of breath with exertion. I am getting attacks of severe shortness of breath and coughing that usually occurs while I'm sleeping. I have developed edema and had a mild leg swelling a while ago.
Do you have severe chest pain called angina palpitations or syncope?
No, doctor, but I feel some irregularity in my pulse over the past 10 months. These symptoms have been gradually worsening over the past year. I've gained about 20 kilograms in weight, doctor.
What's your age?
63, doctor.
Have you had any previous illnesses?
I had right inguinal hernia surgery 7 years ago. I had trauma to my right thumb.
Do you have diabetes mellitus or heart murmur?
No, doctor.
Do you smoke or drink?
I don't smoke, but I drink.
Tell me about your family history and the illness.
My mother's alive at 92. My father died at 76 of a heart attack.
Are you taking any medications?
Yes, doctor. I take aspirin 81 mg daily and chlordiazepoxide and clydinium combination pill at 5 mg or 2.5 mg, 1 tablet daily for stress.
Are you allergic to any medicines?
No, doctor.
Okay, well, according to my comprehensive cardiovascular examination, your blood pressure is 120/70 in each arm seated. Your pulse is 80 beats per minute and regular. Your breathing is 2 times per minute and that is unlabored. Lungs are clear to auscultation and percussion. The first and second heart sounds are normal. You have a fourth heart sound. And a soft systolic murmur. The precordial impulse is enlarged. Your electrocardiogram shows sinus rhythm with left ventricle hypertrophy. Your peak oxygen consumption was 19.7 milliliters per kilogram of Balti mass per minute, which is consistent with mild cardiopulmonary disease. Laboratory data shows your thyroid-stimulating hormone 1.33, your glucose is 97, and creatinine is 0.9, potassium is 4.3. I reviewed your echocardiogram thoroughly, that shows a dilated cardiomyopathy with ejection fraction of 15%. Your post-stress ejection fraction is 33% and left ventricular cavity appears enlarged. This appears to be a newly diagnosed dilated cardiomyopathy of uncertain etiology and dyslipidemia. I'm going to prescribe angiotensin converting enzyme inhibitor lisinopril 2.5 mg daily and a beta blocker covered a little 3.125 mg twice daily. In addition, you could benefit from a loop diuretic, furosemide 20 mg daily. I don't think you need a defibrillator right now. And after 3 months of medication, I want you to go on an echocardiogram. If your left ventricular function has not improved, then you would benefit from a prophylactic use of an implantable cardioverter defibrillator. So continue with these medications and meet me after a period of 3 months.
Thank you, doctor.
Extract 2, questions 13 to 24. For questions 13 to 24, complete the notes with a word or short phrase that you hear. You now have 30 seconds to look at the notes.
Do you mind explaining to me how that appointment got you here today?
Yeah, sure. I went to the doctor's last week and we had done some tests. And found out that I have very high cholesterol. And so I have an appointment with you today. Because I would like to weigh out some of my options as opposed to immediately going on medication.
Okay, great. So we'll just get started by asking a few questions. What do you generally do to start off your typical weekday?
Well, depending on what day of the week it is, I wake up between 6:30 and 7:30 in morning. First thing I do is take a shower. Brush my teeth, make a pot of coffee. Get dressed, and usually after that I start my work day.
All right, and what do you do for a living?
I have 3 jobs. On Mondays and Tuesdays, I do toxicology at County Medical Examiner's Office. For post-mortem there. The rest of the week, I work as a lab technician at Belmont's Hospital. After an 8-hour shift each day, I go straight to the Ruby's in downtown where I work as a bartender and a server.
Wow, so you definitely are keeping busy throughout the week. Do you think during all these busy work hours you have time for meals?
I do. I don't eat breakfast. It usually doesn't make me feel too well. I have my coffee as my breakfast. There's a lot of fast food places that I go to in between going to jobs, or on my lunch break like Taco Bell, Burger King. There is also a Subway next to one of my jobs. Actually, when I get home from work, especially if I'm at Ruby's, I'm always really hungry. So I'll grab some ice cream from Friendly's.
Okay, and on a scale of 1 to 10, 10 being the most stressful, do you find yourself stressed working all these hours?
I would say on a scale of 1 to 10, definitely close to a 10, around a 9.
Okay, so you're stressed out, and do you think that has effect on your eating habits?
Having ice cream after a long day definitely makes me feel better at the end of the day. But I don't think the stress has too much influence on my diet.
Okay, all right. So do you live with anyone at home?
I am currently living with my boyfriend.
All right, is there any type of exercise going on throughout all these busy days of yours?
I used to run on the treadmill before I accumulated all my jobs, but now I don't really find the time.
All right, does anyone in your family have high cholesterol as well?
My dad is on medication for high cholesterol and a lot of his siblings have high cholesterol.
So it's kind of in the family.
Yes, it is.
That is the end of Part A. Now look at Part B. Part B. In this part of the test, you'll hear 6 different extracts. In each extract, you'll hear people talking in a different healthcare setting. For questions 25 to 30, choose the answer A, B, or C, which fits best according to what you hear. You'll have time to read each question before you listen. Complete your answers as you listen. Now look at question 25. You hear a discussion about different types of kidney cancers. Now read the question.
Hello, doctor. Can you brief me about different types of kidney cancers?
Like any other cancer, kidney cancer starts when the normal cells in one or both kidneys mutate and grow aggressively, forming a tumor or mass, which can be benign or malignant. Kidney cancers that have originated elsewhere and metastasized to the kidney are clear cell adenocarcinoma, transitional cell carcinoma from the bladder, renal lymphoma, inverted papilloma, carcinosarcoma, teratoma, and carcinoid tumor of the renal pelvis. Renal cell carcinoma is the most common type of kidney cancer that accounts for 80 to 85% of all cases. This develops within the microscopic filtering systems of the kidney, which are the tiny tubes that carry the urine to formation. Transitional cell carcinoma, also known as urothelial carcinoma, usually begins in the area where urine collects before moving to the bladder. Pathologically, this cancer is similar to bladder cancer and is treated like bladder cancer. Kidney sarcoma is a rare form of kidney cancer. It is usually treated with surgery and chemotherapy. Sarcomas may be large and usually does not spread. Wilms tumor is a common type of kidney cancer that occurs among children and is treated differently than kidney cancers in adults. Common treatments for Wilms tumors are radiation therapy and chemotherapy. Squamous cell carcinoma, juxtaglomerular cell tumor, arenoma, Bellini duct carcinoma, mesoblastic nephroma, mixed epithelial stromal tumors are other types of kidney cancers.
Now look at question 26. You hear the discussion between 2 doctors about types of perforations during endoscopic retrograde cholangiopancreatography. Now read the question.
Doctor, can you explain the types of perforations during endoscopic retrograde cholangiopancreatography?
Although perforation is an unusual complication of endoscopic retrograde cholangiopancreatography, the diseases of the duodenum in common bile duct can increase the risk of perforation during endoscopic retrograde cholangiopancreatography. There are 4 types of perforations during endoscopic retrograde cholangiopancreatography based on etiology and site of perforation. Type 1 is perforation of the lateral or medial duodenal wall caused due to excessive pressure from the endoscope or its acute angulation. Type 2 perforation is periampullary injury, often associated with sphincterotomy or difficulty accessing the biliary tree. Type 3 perforation is injury to the common bile duct or pancreatic duct caused by instrumentation. Type 4 perforation is the presence of retroperitoneal free air with no evidence of actual perforation. This is usually an incidental finding and is of little or no clinical consequence.
Now look at question 27. You hear a discussion between two doctors about clinical manifestations of alpha-1 antitrypsin deficiency. Now read the question.
Hello doctor, what are the clinical manifestations of alpha-1 antitrypsin deficiency?
Well, alpha-1 antitrypsin deficiency is a genetic condition that can cause lung and liver damage. Alpha-1 antitrypsin is a protein that forms in your liver and moves through your bloodstream to your lungs. Alpha-1 increases your risk of developing certain diseases, including emphysema, that is damaged air sacs in your lungs, cirrhosis, the liver scarring, and panniculitis, which is an uncommon skin condition. Some of these conditions can be life-threatening. Alpha-1 is sometimes referred to as genetic COPD or genetic emphysema. It's the off switch for an enzyme called neutrophil elastase. Neutrophil elastase is important for fighting infections in your lungs, but it can also destroy your healthy lung tissue. After elastase has had time to help fight an infection, alpha-1 antitrypsin shuts it off so it won't damage your lungs. If a gene mutation causes low levels of alpha-1 antitrypsin or creates incorrectly formed alpha-1 antitrypsin, you won't have enough in your lungs to stop elastase, which will start breaking down the protein elastin in your lungs. Elastin gives strength to the small air sacs of your lungs and allows them to stretch and contract, like a rubber band. Without it, your alveoli lose their shape and become floppy. This makes it so you can't breathe or get oxygen properly. This is a condition called emphysema. Gene mutations that change the shape of alpha-1 antitrypsin keep it from moving out of your liver. It builds up there and can cause scarring. Since it can't get out of your liver, it's not able to move to your bloodstream and your lungs. Alpha-1 isn't necessarily a terminal illness. Many people with alpha-1, especially if they don't smoke, can live a normal lifespan. Now look at question 28. You hear a discussion between a doctor and a nurse about autoimmune liver disease. Now read the question.
Hello, doctor. What are the autoimmune liver disease?
Autoimmune liver diseases occur when the body's immune system attacks the liver, causing inflammation. If left untreated, the liver inflammation may eventually cause cirrhosis of the liver, which may lead to liver cancer and liver failure. Although a number of autoimmune conditions may involve the liver, the three most common autoimmune liver diseases are autoimmune hepatitis, primary biliary cholangitis, and primary sclerosing cholangitis. These conditions may occur individually or as part of overlap syndromes. Autoimmune hepatitis can affect both children and adults and can lead to cirrhosis and acute liver failure. It is often asymptomatic, with no symptoms prior to liver failure. It may also be associated with non-specific symptoms including fatigue, nausea, abdominal pains, or joint pains. Primary biliary cholangitis occurs when the biliary ducts within the liver are destroyed by the body's own immune cells, impairing the liver's ability to excrete bile. It affects women more often than men. It may be asymptomatic or may be associated with symptoms such as fatigue, itching, dry mouth, dry eyes, high cholesterol, or bone disease. It may occur in association with other autoimmune conditions. If left untreated, primary biliary cholangitis can lead to cirrhosis and liver failure. Primary sclerosing cholangitis is characterized by inflammation and scarring of the bile ducts, which can prevent bile from passing through. Like other autoimmune liver diseases, it may be asymptomatic or may be associated with symptoms such as itching or jaundice. Primary sclerosing cholangitis can affect both children and adults and is frequently encountered in association with inflammatory bowel disease. Complications of primary sclerosing cholangitis include liver, gallbladder, and bile duct cancers, as well as biliary infections and cirrhosis.
Now look at question 29. You hear a discussion about brain chemicals involved in mood regulation. Now read the question.
Hello, doctor. What are the brain chemicals involved in mood regulation?
Basically, there are three molecules chemically known as monomins that are involved in mood regulation. Serotonin has been coined the brain's feel-good chemical. Norepinephrine is another neurotransmitter connected with depression and how alert the feelings. A low level of norepinephrine is considered to be associated with the brain fog that many people with depression experience. Whereas low levels of dopamine and the part of the brain called the substantia nigra associated with Parkinson's disease. But there is much more to dopamine. In the frontal lobes of the brain, it is associated with complex thinking and problem solving. In fact, it is considered that the stimulatory effects of chemicals such as nicotine and cocaine are related to their effects on the dopamine-mediated reward centers in the brain.
Now look at question 30. You hear a discussion about different types of gastric juices. Now read the question.
Hello, doctor. What are the different types of gastric juices?
Gastric juice is made up of water, electrolytes, hydrochloric acid, enzymes, mucus, and intrinsic factor. Hydrochloric acid is a strong acid secreted by the parietal cells, and it lowers your stomach's pH to around 2. Hydrochloric acid converts pepsinogen into pepsin and breaks various nutrients apart from the food you eat. It also kills bacteria that comes along with your food. Pepsinogen is secreted by chief cells, and when it's in the presence of hydrochloric acid, it's converted to pepsin. Pepsin breaks apart tertiary and secondary protein structures to make it easier for the digestive enzymes in the small intestines to work later. Gastric lipase is another digestive enzyme made by the chief cells. It helps break down short and medium-chain fats. Amylase is also found in gastric juices, but it isn't made by the stomach. This enzyme comes from saliva and travels along with the bolus into the stomach. Amylase breaks down carbohydrates, but it doesn't have much time to work on the stomach because the acidity stops it. That's okay, though, because your small intestine introduces more amylase later on. The mucus is secreted by the neck cells and helps coat and protect your stomach lining from the acid environment. Intrinsic factor is secreted by parietal cells and is necessary for your body to absorb vitamin B12. This is essential for healthy nervous system function and blood cell production.
That is the end of Part B. Now look at Part C. Part C. In this part of the test, you'll hear 2 different extracts. In each extract, you'll hear health professionals talking about aspects of their work. For questions 31 to 42, choose the answer A, B, or C, which fits best according to what you hear. Complete your answers as you listen. Now look at Extract 1.
Hello everyone and welcome to the first in our special series of lectures on medical breakthroughs. Today's guest is going to talk to us about a recent discovery in the use of machine learning. Welcome, Dr. Atkins.
Thank you very much for your kind introduction. I am very excited to be here today to talk about my team's research.
So let's start off by having you give a brief introduction. I mean, this is an area that is completely new, so we need to have a foundation before going into the details.
Of course. So my team has recently discovered a neural signature that can help to predict whether individuals with depression are likely to benefit from sertraline, a commonly prescribed antidepressant medication.
That is wonderful news. I know currently doctors often use trial and error to find the best antidepressant for a patient. This discovery can help patients on the road to recovery a lot.
Yes, there is a great need in psychiatry today for objective tests that can inform treatment and go beyond some of the limitations of our diagnostic system. And this research helps to get us closer to that goal. As a researcher, I am particularly excited about these findings because they show the potential of bringing sophisticated data analytic methods to psychiatry.
So let's go more into the details of those sophisticated data analytic methods.
Okay, but first let me back up a bit to some previous research that led us to this current research. So earlier research suggested that specific components of brain activity, as measured by resting state electroencephalography, could give us some insight into how people will respond to certain treatments. So we use this insight along with insights from other fields such as neuroscience, clinical science, and bioengineering to build an advanced predictive model. From there we developed a new machine learning algorithm to analyze the electroencephalography data.
Okay, and what exactly is the model predicting or analyzing?
Idea is that the algorithm can identify robust and reliable signatures of antidepressant treatment response. We use the algorithm to analyze data from participants in a large clinical trial of the antidepressant medication sertraline. Specifically, we apply the algorithm to the participants' pre-treatment data to see if machine learning could produce a model that predicted participants' depressive symptoms after treatment.
Okay, just to make sure I understand, so you knew there was a way of analyzing brain activity to see how well patients would respond to a particular medication for depression.
Well, I wouldn't say we knew, but that was our hypothesis.
Yes, of course. So what were the results of the study?
Well, the machine learning algorithm was able to reliably predict individual patient response to the medication based on a specific type of brain signal. Alpha waves. In fact, this model, based on electroencephalography data, outperformed conventional models based on other types of data such as symptom severity or demographic characteristics.
That sounds like great news. I do have one question. So you said this algorithm was able to predict participants' response to this particular medication. Let's say it predicted that this medication wouldn't work for a participant. What does that mean?
Great question. So participants that the model predicted little improvement with this particular medication were found to be more likely to respond to treatment involving a specific type of non-invasive brain stimulation called transcranial magnetic stimulation.
I see. And if the further research in the works using this machine learning algorithm?
Certainly, analysis suggests that the predictions made by the algorithm may extend to broader clinical outcomes beyond the response to this particular medication. And of course, we need to replicate these findings in larger samples to determine the value of the algorithm as a diagnostic tool.
Exciting. We will certainly be hearing more from you and your team. So now I want you to look big picture for a moment. What do you think will be the future impact of machine learning on your field?
Wow, that is a big question. But if I had to make a prediction, I mean to say what I'm most excited about.